Stephanie, and I'm with 9 Health, and this is Health Happens, our weekly Facebook Live show we do every Tuesday to bring you objective, real health information so you can live a healthier life. Today we are at an eye office. We're at Bryan Vision Associates. This is Dr. Stacy Spalding, and we're going to talk with her in just a moment. Last week, I do want to remind you, we were at Colorado Athletic Club, and we talked about easy exercises you can do at home, the office, wherever. So there's really no excuse if you can't get to the gym. Get some exercise in. You can check that out on our Facebook page or on our website, 9healthfair.org. But now we're going to talk about our eyes. It's Save Your Vision Month, March is, and we are going to run through an eye exam here at Bryan Vision Associates, again with Dr. Stacy Spalding. Thanks for joining us.
Well, thank you for coming.
Of course. So this is kind of where you do the eye chart first if you come in for an eye exam.
Correct. So every time you come in for an exam, whether it's an emergency visit, whether it's a routine eye exam, the first thing you'll do is read the eye chart, see how far down you can go.
We've all seen the letters. And
then the next place we come is to the pre-test room.
Okay.
So we are actually going to run through a few instruments so you can see how those work. I will have you take a seat right here.
Because an eye exam is, critical for preventing issues with your eyes or just detecting issues with your eyes.
Absolutely.
So getting an eye exam is something we should all be doing.
And
how often?
An eye exam should be done every year, whether you wear glasses, whether you wear contacts, whether you don't wear glasses or contacts.
Okay.
You should have an eye exam every year to screen for eye disease and check for vision changes or problems.
Okay.
So the first instrument that we are going to use is called an autorefractor. It takes a screening on your prescription. It also measures the curvature of the front of your eyes, and you use that to fit contact lenses.
Okay. So we're running through all these instruments so you can see a basic eye exam, not scary, easy to do, quick to do.
Quick and easy, painless.
Right.
So I'm going to have you lean your chin in here,
Okay.
forehead against the forehead rest. Is that height all right for your neck?
Yes. I'm good.
So you will just watch that hot air balloon.
I'm seeing a hot air balloon. It's kind of gets blurrier and sharper.
Yeah, so what she's seeing is a hot air balloon kind of with the landscape, and that keeps your gaze, kind of tricks you into thinking you're looking at something far away. And so it gets both the readings that I need that quickly. So you can go ahead and lean back out of there.
And that determines changes in prescription if you have one or if you need one?
Exactly. So if you come in and you're not currently wearing glasses or contacts, we're starting from scratch. It gives me an idea of where to begin to check your prescription.
Okay.
Now this is the air puff. This is one of the tests for glaucoma. It measures the pressure inside your eye.
Okay, and there was some stat about glaucoma that you guys had talked about before too, that many people might not know they have glaucoma?
That's very true. When glaucoma begins, it's painless, symptomless loss of vision. The vision loss begins in the periphery, so it has to become pretty advanced before you actually notice it.
So getting a yearly eye exam, you would see any of those changes?
Exactly. So is that height all right for your neck?
It's good.
Okay, so you will just watch that blinking light. This comes in close to you. It does not touch the eye.
And it's just a little puff.
Just a little puff.
It didn't hurt.
Now, eye pressure can be measured two ways. Some offices will, go ahead and lean back out of there. Some offices will do a screening with the air puff. Some offices will check your eye pressure in the exam lane when you're behind the microscope.
Okay.
And then this is a screening test on your side vision or your peripheral vision. This is another test, or one of the additional tests we do for glaucoma. With glaucoma, we're looking at health inside the eyes, we're looking at eye pressure, and your side vision.
Okay.
So I'm going to give you that clicker, and then you will lean your forehead in. You will see a black square on a light background. That square is your fixation target. You will watch that the whole time. In your side vision, you will see bar gratings flash on and vibrate. Every time you see a grating, no matter where it is or how faint it is, you want to press the button on the clicker.
I just pushed even though we hadn't started. And if people can't see stuff on the edges, that's a sign that maybe glaucoma is developing?
Correct. So the test of side vision will give you information on several conditions. Glaucoma, you'll start to see a change in your peripheral vision. If somebody has macular degeneration, it may be more of a central vision loss. Every now and then you may get a loss that's related to like a tumor.
Okay.
Okay, and then I'm going to go ahead and stop that. You can lean back out of
Okay.
there. Now that we've seen that.
I think I'm doing okay.
So far, so good. And then we are going to go around the corner
Okay.
and look at doing some retina photos.
Okay. And we're kind of going through the whole process of an eye exam again. If you have any questions on Facebook, just let us know, and we will ask Dr. Stacy Spalding here at Bryan Vision Associates.
Okay.
She can help us answer
Yes.
those questions.
So I'll have you go ahead and you can take a seat right
Okay.
here. And we'll kind of talk about this instrument. This is called the Optos. This camera takes photographs of your retina.
Okay.
For many patients, the Optos will get a good enough view of the retina that you don't have to get dilated. Some patients, you may see something in the retina, you may still dilate,
Okay.
but it does do a good job at screening retinal health. When you take the photograph, your face is actually against the instrument looking
Okay.
into the opening. You take exactly, as you look in, we take several digital photographs of each eye. This is an example of a
Okay.
photograph.
Oh, wow.
So it's kind of neat. We're looking, through your pupil at the retina, which is that tissue lining the very back part of the eye.
Okay.
With the camera, we can zoom in, I can zoom out. We're able to see the nerve, the macula, the peripheral retina.
And is this a healthy eye that we're looking at?
This is a healthy eye. So this is a 50-year-old male with no eye disease.
Okay.
So,
What kind of things would you see on here that would indicate any problems?
So with glaucoma, sometimes you will see obvious paling of the nerve. This contour, this light area will change in shape or size. Sometimes you can detect systemic disease like diabetes,
Okay.
with hemorrhaging in the retina. High blood pressure can cause hemorrhaging. It can also cause thinning or narrowing of the arteries.
So you're not just checking your eye health, you're checking for
Checking a
other
lot of
conditions too.
things.
You can see diabetes, any conditions with heart health.
And macula, you're looking for macular degeneration. Peripheral retina, you're screening for things like a hole or tear detachment.
Okay.
Yeah.
So even if you can see stuff and you think your eyes are healthy, it's still good to get checked and make sure you can. Do you have a question? What question do we have?
Can dry eye cause intermittent blurring?
Yes, it can. The tear film is part of the optics of the eye, so as you blink and open your eye and your tear film evaporates, your quality of vision can go down. Dry eye will give you fluctuating vision where it kind of comes in and out, and you find yourself blinking a lot. That's different than a change in prescription or an eye health issue where you get blurred vision, that it's pretty consistent.
So drops would fix that if it's just dry eye?
Yes, artificial tears would help with that.
Okay.
Yeah.
Great question. All right. So now we're going to go into an exam room. So after you've done this part of the exam, you come
So you
to...
come across to the exam lane. And
I'm
yes,
going
go
to sit in the
ahead and have a
exam
seat right
chair.
here. And then when you come into the exam lane, there's a couple additional pieces of equipment that you use. The 4-opter is used to check for prescription, check focusing, how your eyes are working up close, check eye alignment, how the eyes are working together. The microscope checks health at the front of the eyes. You can use lenses to look inside the eye also. So generally when we come in the lane, we'll check prescription, we'll check eye health, we'll pull up the retina photos and look at those together, or we may put drops in the eyes to dilate the eyes and do a dilated exam.
Okay, so it's kind of an expansion of what we just did in the other room, just a more detailed look at things.
Correct.
Okay. Okay, awesome. So I did want to talk to you as well. So eye exams are obviously important, and you said we should get them annually. Even
Yes.
how young should you start getting those, like kids?
That is a great question. So adults and kids need an eye exam every year. I do recommend that kids have their first eye exam by the time they start school, that preschool age, to make sure they're seen well in the classroom. So much of learning is vision related. Infants can have eye exams also. So sometimes you will have a family history of an eye turn or a lazy eye. Maybe a parent is concerned about eye alignment in a photograph, or pupils don't look right in a photograph.
Right.
There are providers that'll do infant eye exams. They are looking for things that affect normal vision development. High prescription in one or both eyes,
Okay.
eye turn, eye health issue.
Okay, but at least if there's not any conditions prior when you're a little baby, starting around preschool age on up, you should be coming every year to the eye doctor and kind of getting your eyes checked.
Exactly.
And there's other things we can do for our eyes as well. What else can we be doing to save our vision?
So I think there's quite a few things to talk about. That's a pretty expansive topic. One of the big things is computer vision, and I think there's three main things
Right.
with the computer.
Like I can see fine generally, but I have reading glasses because I don't rest my eyes when I'm using the computer. So they're nice to have when I just have to keep staring. So talk about what you should be doing.
Yes,
in here.
so I think kind of the three big things with the computer is focusing. The focusing muscle can just get tired. You can address that with computer glasses. You can address that by taking breaks, thinking about every 20 minutes, look up across the room 20 feet away for about 20 seconds.
Okay, yeah, good excuse. Take a break every 20 minutes, look across the room, and just focus on something far. Okay.
Dry eye is also an issue. You don't blink as much when you're reading or working on a computer. The eye gets dry, vision can fluctuate, the eye can get tired. Thinking about blinking, keeping yourself hydrated, those are all important things.
Okay.
And then blue light. Blue light comes off all of our screens.
Right.
It's hard.
Phones.
It's hard to focus. We can address that with the coating
Okay.
on our glasses. A anti-glare coating that filters blue light can make your eyes more comfortable. Potentially could help with eye health issues too.
Okay.
There's some early research that may be associated with macular issues.
Oh, wow. Okay. So, and if you are using those screens, your phone, blue light, and you're seeing all that stuff and you don't have glasses, you don't have that protection, just again, take breaks even when using your phone.
Exactly.
Don't stare at it all day long.
Exactly.
Or try not to.
Tell you, I have got, my mouth is getting really dry. I've
Oh,
got
that's
to have
fine.
some water to keep
Dr.
talking
Stacy
to you.
Spalding needs a drink of water. That is allowed. You are allowed to have water. And we're going to talk to her in just a moment, too, because we're in the winter months right now, and I think a lot of us...
So-
oh, yeah, that's fine. I wanted to
Yes,
ask you,
you are.
we're in
It's like,
winter. Oh, that's fine. We're in winter and heading into spring, too. I wanted to ask you about UV protection. I think sometimes even I forget in the winter. It's sunny here, but, like, I don't think about wearing my sunglasses as often as I do in the summer or wearing a hat or something.
Yes, and UV protection, especially with the altitude, Colorado, we live an outdoor lifestyle. UV
Right.
protection is really important. A hat and sunglasses, both for adults and for kids. If you can get even infants used to wearing a hat, that really is very helpful for their long-term eye health.
Right.
You think about kids, they have big pupils, they spend a lot of time outside, they get a lot of UV exposure. Sunglasses should filter 99 to 100% of UV light. Sunglasses come in different tints, and the tint that you pick kind of depends on what you're doing.
Okay.
Gray versus brown. Often sports where you need to check distance, I'll recommend a brown lens.
Okay.
Kind of enhances contrast.
Yeah, I was going to ask why a brown lens. Okay.
Gray is just a nice all-around lens. Gray doesn't change color perception quite as much as a brown lens. Polarization is a great thing in Colorado because polarization has a filter for glare off horizontal surfaces.
Okay, another treatment
So-
you can kind of put on lenses. Okay.
So that's actually a filter in the lens.
Okay.
So glare off a flat road, glare off snow, water, people who like to fish and boat, it'll take that glare off the water surface, so polarization can improve vision in those situations or circumstances also.
Okay, good. So yeah, when you're maybe you're just at a grocery store and you're getting non-prescription sunglasses, just make sure the sticker says like 99.
Yes, UVA
Okay.
and B protection.
Okay, and I wanted to talk too, so like the things we put in our bodies, obviously, nutrition, things we eat, things we drink, that affects our overall health, but can affect our eye
Yes.
health. So what are some
Oh.
good things for eye health?
Absolutely. And generally the things that are good for your health of your body are good for the health of your eyes. Certain nutrients we know are very helpful for maintaining eye health. Things like lutein and zeaxanthin.
What are those? What are those usually in?
Those are nutrients found in dark green leafy vegetables,
Okay.
spinach, kale, eggs.
I tell my
broccoli.
toddler to eat carrots to have superhero vision. Is that a true
Yes.
statement?
Yes, the antioxidants. Green tea also has lutein
Okay.
in it. Lutein is found in healthy maculas. We know macular degeneration patients have some depleted levels of those.
Okay.
So getting those nutrients through your food is really important in protecting macular health. Patients who have macular degeneration or maybe are at very high risk of macular degeneration, their doctor may actually prescribe a certain vitamin for them to get those as a supplement.
Okay. And I did want to ask too. We've mentioned macular degeneration a few times now. What would some symptoms be of that you don't really know what it is and you're noticing a
So-
change in your eyes, what would symptoms be
So
that's?
early macular changes, patients may not really have many vision symptoms.
Okay.
Sometimes we detect it with their eye exam before they're really aware of it. And then we can start focusing on things that protect their macular health, like the prescribed vitamins, UV protection, blue light filter. When macular degeneration progresses and starts affecting your vision, it is affecting the health of the central part of your vision.
Okay.
So you can have pockets of vision loss, distorted vision.
Okay.
You know, if you look at a doorway, it may lean or kind of wobble instead of being
Interesting.
straight. If macular degeneration becomes more advanced, patients can have quite a devastating loss of their central vision.
Okay. Yeah, I was just curious what kind of symptoms you would see and what problems you would have if you were experiencing something like that.
Yeah.
But if you have yearly eye exams, hopefully you can stay on top of seeing
Yes,
something like
that's our
that.
goal.
And then I have a couple more questions just about eye health in general, other things we can do in addition to an eye exam. I wear makeup. Females wear makeup. Is that okay to wear makeup? How are there tips for?
It is okay, but you do have to kind of pay attention to hygiene around the eyes.
Okay.
I recommend that you are good at changing out or throwing away mascara and liquid eyeliner every 3 months.
Okay.
Pencils need sharpened regularly. We have staph bacteria that grows in our skin. It really likes the eye area.
Oh, great.
So you're trying to minimize growth of bacteria on the makeup. The other thing you want to make sure you do is line your eyes outside of your lashes. If you're
Okay.
lining inside, you can be putting eyeliner over the oil glands that produce part of your tear film and blocking that oil expression. The other thing I recommend is that you are good about taking your eye makeup off at night with a gentle eye makeup remover. If you just wash your face and leave the mascara on, sometimes that can harbor bacteria around the edge of the lids and the lashes.
And if you do have bacteria around your eye, what kind of problems would that create? Is that like a sty? Is that?
So that can be definitely a sty. It can aggravate dry eye. The byproducts from the bacteria can get into the tear film and be an irritant to the front of the eye.
Okay. So yes, makeup along the outside, not on the inside.
Yes.
And change your pencils and mascara every 3 months. And then we let's talk about people that do wear like contact lenses. How does that affect your eye health, like wearing a contact lens? And
So there are a lot of kind of hygiene issues and disinfection issues with the contact lenses you need to pay attention to. I really recommend that you follow the prescribed care regimen that your doctor gives you and the replacement schedule. You know, if you are supposed to replace your lenses every month, you really should do that. The instructions they give you to rub and soak your lenses, you need to follow those instructions. You need fresh solution in your lens case every night.
Okay.
If you're topping it off, if you're continuing to use the same solution day after day, it loses its effectiveness.
okay.
After you insert your contact lenses in the morning, I recommend you rinse your case with solution, put it face down on a clean tissue to air dry it. Cases should actually be replaced about every 3 months because
Okay.
they do get
3 months is our magic number. Replace
It
your contact
is.
lens cases too.
And especially, guys will carry their contact lens case in their pocket and, they just get dirty. They can get contaminated. And as you wash your hands, then handle the lid and,
Right.
getting contaminants on those fingers. We've got summer coming up. Really, we recommend that you don't wear your contact lenses, swimming, pools, hot tubs, lakes, rivers.
Okay.
There's an avenue for infection, for getting water on your lenses.
So instead wear maybe protective goggles, like prescription goggles or something, if you do have a prescription where you want to see underwater or...
Exactly,
Okay.
goggles, or sometimes I'll put patients in a one-day disposable. If
Okay.
they have a high prescription, they can't swim without contacts, they'll wear their goggles over the top and then throw that pair of contacts away when they get out of the pool.
Okay, and what other, just speaking of goggles, what other times should people be protecting their eyes with protective glasses and goggles? Are there times you wouldn't think to wear them?
There definitely are. People think about wearing eye protection when they're at work, if they're...
Construction or something.
Exactly,
Yeah.
but often you don't think about eye protection at home. Again, with summer coming up, you do see patients get foreign bodies or abrasions doing yard work. So it's good to wear eye protection mowing your lawn, pruning bushes. You go
Okay.
for one branch and another branch hits you in the eye.
Right. That's not
That
good.
happens. Working with chemicals, cleaning products, splashback can happen. You see patients with chemical burns from that. Definitely with things like paintball, or the airsoft guns.
Yeah.
People don't sometimes think about eye protection with those, and that's
Right.
really important.
Yeah, if you're playing paintball, please wear goggles.
Yes.
Do we have any other questions from Facebook right now?
Yes, we have a question from Susan. She asked, what causes cataracts?
Cataract is kind of a normal aging change in the lens of the eye. There are some things that are risk factors for cataract. Smoking, UV exposure, being outside without your sunglasses can maybe cause a cataract earlier. Cataract is when the lens in the eye becomes opaque or hazy, and it reduces your quality of vision no matter where you look. It's kind of like looking through a blurred windshield.
Is that something we can all kind of expect as we age, or is there... If you do eye exams and know these are prevention measures, you can
if you live long enough, most of us will eventually get a cataract.
Okay.
Like I say, wearing sunglasses can help. We'll talk about nutrition a little bit. Well, we talked about nutrition briefly.
But not
and
smoking,
actually,
too. You just mentioned
not
smoking.
Smoking is a really big risk factor. Antioxidants like vitamin C, there has been some research that indicates that may delay onset of a cataract or progression of a cataract.
Okay. So all good stuff. And that was one of my other questions, too, was about smoking and eye health. So we talked about it causing cataracts. What else can smoking do to your eyes?
It is a big risk factor for macular degeneration, particularly for women.
Interesting.
Smoking can also aggravate dry eye and eye redness.
That
and
makes sense,
inflammation.
yeah. Okay. And it being Save Your Vision Month, it's March. Is there anything else you want to tell people about things they should do to keep their eyes healthy?
I think the big thing is having an annual eye exam to
Okay.
address eye health, any vision needs. Yeah.
All right. So call your eye doctor, get an eye exam, quick and easy.
Yes.
We did it super fast, and then we sat here and chatted for a while. So we didn't go into all these instruments and what they do, but I've had an eye exam before, and these don't take long either. So it's very simple and very easy. Is there anything else?
Yes, we have a follow-up question. Is cataracts hereditary?
They can be. Often you will see hereditary cataracts linked to systemic conditions. For example, if muscular dystrophy runs in your family, one way that may be shown is through early cataracts. You know, somebody may get cataracts in their 40s or their 50s.
And while we are kind of talking about other health conditions, I mentioned earlier just detecting or looking at heart health by looking at your eyes.
Yes.
Have you referred anyone? Like, have they come in and you've seen something in their eyes and you referred them somewhere else, or a cardiologist, or to go see their primary care?
Yeah, absolutely. And I think diabetes is the big one. You'll have patients come in, you'll pull up their photos, and you'll say, I think blood sugar is a concern for you. And we get them back into a primary care doctor to get that tested.
Awesome. Okay. Well, and I also wanted to let everyone know that our 9 Health Fairs are coming up. You can go to 9healthfair.org and click on Find a Fair, and you will find a fair near you. And there's a vision screening that you can do at the 9 Health Fair. And if there is an eye doctor that's volunteering, you can get an eye health check as well. So it's good to go to the health fair, too, to get an eye check. Are there any other questions from Facebook? All right. If that's it, I think we'll sign off for now. And thank you so much for talking with us.
Thank you for coming.
Of course.